Asthma. How to use an inhaler with a spacer correctly. A guide for parents. This video will talk about a disease called asthma and how to give medications to a child who has asthma. Please watch this video all the way to the end, as there is a lot of important information in the video. Asthma is a disease that makes it hard for some people to breathe because the airways in their lungs become tight and swollen. Asthma can cause coughing, wheezing, chest tightness, and shortness of breath, especially when someone has a runny nose, exercises, or when they are around smoke. Asthma can't be completely cured, but medicine and avoiding situations that can cause asthma can help control it. Asthma medicines help children breathe easier by reducing swelling in the airways and relaxing the muscles around them. The medicines are often given through an inhaler and should be used exactly as directed by a doctor. An inhaler is a small handheld device that allows you to breathe medicine in through your mouth directly to your lungs. Your doctor will work with you to come up with a plan for your child's asthma called an asthma action plan. The doctor will help you understand which type of medicine you will need to help your child and how to give it. The doctor will give you a prescription to pick up your child's inhaler at the pharmacy. There are two main types of inhalers used to treat asthma. Rescue inhalers work quickly to open the airways during an asthma attack or when asthma symptoms suddenly start. Rescue inhalers contain a medicine called albuterol. Maintenance, controller inhalers are used every day to help prevent asthma symptoms and reduce inflammation in the airways. There are many different kinds of maintenance inhalers, and many of them contain medicine called steroids. Some inhalers have both medicines, albuterol and steroids, in one inhaler. These can help treat asthma attacks and help prevent them. Ask your child's doctor which inhalers your child has. Follow your child's asthma action plan to know when to use each inhaler. The color of an inhaler can change depending on the company that makes it. Do not use the color to guess what medicine is inside. Always check with your doctor to make sure you know which inhaler helps to prevent asthma attacks and which is used to treat a cough, wheezing, or trouble breathing. You should bring your child's inhaler to each doctor's visit or take pictures of your child's inhalers and have them on your phone. If it's not urgent, you can also send pictures of the inhalers through your patient portal to help confirm the medicine. If your child uses an inhaler with steroids in it, they should rinse their mouth with water and spit it out after using it. This helps keep the medicine from staying in the mouth or being swallowed. A spacer is a tube that attaches to an asthma inhaler and helps the medicine get into the lungs more easily. Instead of spraying medicine directly into the mouth, the spacer holds the medicine for a few seconds so the person can breathe it in slowly and deeply. Spacers help more medicine reach the lungs and less medicine stay in the mouth or throat, which makes the inhaler work better and can reduce side effects. It is important to use the spacer every time your child uses an inhaler, unless your doctor says it's not needed. Some asthma medications do not need a spacer. A mask is used with a spacer when a child is young or has trouble using a mouthpiece. The mask helps your child get the medicine into their lungs. How to use an inhaler with a mask. Check the inhaler. Make sure you have the right inhaler for your child's asthma plan. If you're not sure, ask your child's doctor. Make sure that the inhaler has medicine in it. Check the counter on the inhaler to know how many puffs are left. The inhaler will still spray even when it's empty, so if the counter says 0, there is no medicine in it. Check the mask fit. The mask should cover your child's nose and mouth with no gaps. If you're not sure it fits right, talk to your child's doctor. Remove the cap from the inhaler. Make sure the opening is clean. Have your child stand up. Standing helps the lungs open better. If standing is not possible, have your child sit up straight. Shake the inhaler for 5 seconds. Place the inhaler into the end of the spacer. Ask your child to breathe out all the air from their lungs. Put the mask on your child's face and make sure it fits tight over the nose and mouth. Press the inhaler 1 time. Keep the mask on your child's face. Let your child take 6 to 10 slow, deep breaths. If your child needs more than one puff, wait about 30 to 60 seconds, then repeat these steps as taught in your child's asthma action plan. Make sure other people who care for the child, such as school, family, or childcare, have a copy of their asthma action plan and that they know how to use it.